Let's talk about some easy things that nurses can do to help their patients have better outcomes. Or someone comments and says, I would do this if we had enough staff or if I didn't have a million patients. I hear you. I get it. I've been there. Let's all just do the best that we can with the resources that we're given. The first thing is oral care or having your patient brush their teeth. We should help our patients or encourage our patients to brush their teeth twice a day if they do not have an advanced airway. And if your patient has an advanced airway, then every 2 to 4 hours we should be performing oral care. The next thing is getting our patients up out of bed, moving them, turning them, passive range of motion, active range of motion, any movement that is appropriate for your patient, we should be doing it as much as possible. Number 3 is ensuring our patients are eating and drinking appropriately. In order to heal, we need calories and nutrition. And so if your patient is not eating or drinking as much as they should be, talk with the patient, figure out the barriers, talk with the provider, and come up with some sort of game plan so we can try and get this patient as much nutrition and hydration as is appropriate for them. Number 4 is pericare. If your patient has a Foley catheter, we ideally would like to clean the Foley catheter in that area once a shift or twice a day. Even if your patient does not have a catheter, we want to make sure that that area is staying as clean and dry as possible to prevent any breakdown. Next thing is encouraging our patients to use their incentive spirometer. Just chart it. Let's encourage our patients to use it, show them how, have them do it while you're doing your med passes or you're in the room for something else. We want the patients to open up their lungs so that way we can prevent atelectasis and pneumonias. The next thing we can do is make sure we're scrubbing the hub of all of our IV tubings before we give any medication. Let's try and prevent those bloodstream infections, all right? Here's another easy one. Wash your hands before you go into the room, when you come out of the room, and in between any times where you're removing your gloves and putting new ones on. Wash your hands. And the last thing is keeping all dressings, no matter what they're for, whether it's for tubes, lines, drains, or a patient has a wound, following our orders for changing those dressings, making sure they're clean, dry, and intact, so that way we are not giving our patients higher chances of getting an infection. Okay, that's a lot of things. Let me know if you can add any more or if you have any questions.